everyone, this is Jacqui Cooper with JCooperTravels, and today it's another wellness conversation, Wellness Wednesday, Wellness Monday, whatever day this happens to be when you listen to it, it will definitely help with your health and wellness. We have a topic that is really important to all of us, and we're going to be talking about colon cancer and all the issues around that. Before we talk with Dr. Brown about this topic, this very important topic, I'm going to just share for those that might be new to J Cooper Travels a little bit more about my story, how I got started, and what the talk show is all about. J Cooper Travels got started last year in 2020, and it was all about, and it still is in some ways, where are we traveling around the world for our personal enjoyment, but it's also about how do we travel in life and how do we keep our health, our personal life, in balance, and that includes also our careers and just, our outlook in life. So the topics that we talk about are all about keeping us happy and healthy so we can enjoy the life that we want. So today's topic, is very important because, again, we definitely need to think about screenings. We definitely need to think about what are we doing to keep healthy. My background is just for those that might not know, I'm an attorney, but I'm also a special educator and a mom. And I am very aware that as I grow older, even though I might feel very youthful, there's still certain things that I need to do to help keep my balance and my health. So today, I have on a guest that I've talked with many times before, Dr. Brown. And so I would say go back to a lot of our episodes. We've covered a lot of travel conversations. We've covered a lot of health conversations, and we're continuing to do an ongoing series. I'm going to let Dr. Brown introduce herself in case you guys haven't had a chance to listen to all the wisdom that she's shared with us in the past. Dr. Brown, how are you doing today?
I'm good. Thank you, Jacqui.
Sure. So why don't you go ahead and share your background?
Yes. I'm Dr. Tiffany Brown. I'm a naturopathic doctor. And how I got here is I had my own health journey, problems with my health. And I was going from doctor to doctor, seeing different ones, and they were doing what they were supposed to be doing. But I didn't see no changes in my health. So I started looking in the natural community to see what they were doing. And I got lost and confused because they're doing so much. So I just tried one product and I saw changes and I saw improvement in my health, but I knew I didn't fix my problem. So I started looking for herbalists, naturopathic doctors, anybody who knew about herbal medicine, and there was no one. So at that moment, I realized, okay, this is a niche that I could fill. So 4 years later, here I am. I got a virtual online practice where I can see people from anywhere.
That's awesome. So today's topic
Mhm.
is all about colorectal cancer. So why don't you share a little bit more about why that topic is important and what we should be looking for in terms of what is it?
Hmm. Yes. So the changes for colorectal cancer screening has changed, and that's the reason why I thought that this would be a good time for us to talk about it to bring awareness to make sure you that people are aware, man and female, because and sometimes I used to think about it, it was more of a male's issue, but it's a male and female's issue and it needs to be addressed. But what colorectal cancer is, it is like a third largest, yeah, most cause of cancer death in the United States. And it starts from this focal lesions in the colon wall where the cell changes start happening, and they can get bigger and bigger, and they can protrude outside into the intestinal lumen of the colon and cause problems. And it's where people start seeing changes in their bowel habits, or they might have abdominal pain, or they might have bleeding in the rectum. And because it's bleeding, it'll cause the low iron for people. And so that's when it people will go see their doctor because they're tired or they got abdominal pain, and then that's when the doctors know, okay, let me try check you for colorectal cancer or some polyps or something. And the changes now were recently changed where everyone should be screened at age 45. It was 50, but just May of this year, it changed to 45. So male, female, start talking to your doctor or or even me, and we could maybe do some screening. The main, the best tool for diagnosis is the colonoscopy. That's the most effective diagnostic tool, and that's where you will see your doctors, and they'll refer you for those tests for early, because you want early detection, because then at early detection they can cut the polyps out, and you got better prevention from the incidence of cancer.
I know I kind of waited. I dragged my feet a little bit, but I have been screened and they said, well, I'll see you in 10 years. And so I thought, well, that's great.
You always want to hear that.
Yeah, you definitely like to hear that. So in terms of what are the risk factors, or what should people be thinking about in terms of, are there things that they can do to help their chances of not getting it?
Yes, yeah. So there are things that you can do. We call them modifiable factors, where you can try to change those to help prevent the chances of colon cancer. So most of it's like being overweight. You can change your diet, eat more fiber, because some people don't eat enough fruits and vegetables. And then the smoking is a risk factor, and moderate to heavy alcohol use. And then there's people just sitting around all the time and not getting exercise is a big factor also. Let me look, and this being African Americans are at highest risk, and being of male sex is a high risk also. And people who got inflammatory bowel disease, because they already have like inflammation in that area, and if it's not if your diet and if you're not on the right things to decrease the inflammation, that can increase your chance of having colorectal cancer.
So how can a naturopathic doctor help in terms of you know, this whole area, whether it's prevention, whether it's maintenance, how can you help?
Yeah. So we as naturopathic doctors, what we'd like to do, like even like once people are diagnosed and the polyps are removed and everything is okay, or even before then, we like to tell patients, we talk to patients about diet. We work with them, we stay with them. We don't just give you a bunch of stuff and leave you. We call in, check on you, make sure your diet is going well. If it's not going, we continue to work with you until we get this thing going with you. So we're staying with you. And lifestyle changes, exercising. Are you sleeping? Are you not eating the processed meat? Because there was another thing that was heavy and red meat. We try to cut that back. Um, are you exercising? Are you getting out, enjoying life? And so a lot of diet and lifestyle changes we do. Plus, we want to make sure the immune system is bumped up, because that'll help lower the risk factors. And also, if there's any other health concerns they might have, we'll address those as well. And we like to do, but most definitely botanicals, herb, vitamins, and just really support the patient.
So, what kind of screening are there? I know that when I went through my test, I think that there's probably a lot more new types of screenings that are out on the market now.
Yeah, because the age change has changed there's a lot of stool tests where people can order online to have this done, but most definitely follow up with your doctor first and let them, coach you through the different processes. Because if you are younger, if you're 40, your insurance isn't going to pay for it. So maybe you can order one of those stool tests that comes in the mail, and you do it, send it back in just for your own benefit. Because if it's family history, your family has had this before, then there's a good chance that it might, you might have it also. So maybe you just want to check a little earlier or something. So there's the colonoscopy is the primary one, but then you got a sigmoidoscope, and then you have like some blood tests that'll help, and you got a CT where they can do like a X-ray image. We call it CT of the abdomen to see if any cell changes are in the walls of the colon. There's so there's fecal, like we said, and blood. Yeah, those are the main ones that's out now. But the colonoscope is the number one.
So, is there a rising incidence of colorectal cancer in younger individuals now? Is that why they changed the screening?
Yes, it is because now they seeing a rise in the younger people, and they what I read in one report was that it's because maybe family history may be contributing to this early rise between somewhere between 35 and 50. They seeing an early rise of the incidence of colorectal cancer, and then but they want to start screening at 45, and then keep you screened until about, is it 70? Let me look at my notes. 75 years old, they can do screening, and after 75 years of age, then that's when they say, okay, it's individualized. If that person, health wise, is able to have it, then maybe they can have it. But if they're not, then they won't do the screen. So it's more individualized after 75.
So, how would people contact you if they wanted to reach out to you for any advice or assistance?
Yeah, so I have my website where they can send a message or book an appointment or anything, or my phone number is on there. My website is www.nd as a naturopathic doctor healthcalls.com. I'm on Facebook under ND Health Calls. I'm where I'm most active at. So and my email is on there as well if they want to contact me and we can talk. Or message me however they prefer to reach out for me.
And for those that might not be aware of how a talk show or YouTube works, there will be an information block underneath. So that way, all that information will be there. And I know that Dr. Brown and I are going to be doing different health and wellness events. So definitely reach out to us, like and subscribe, so that way you can stay in contact. And definitely reach out to Dr. Brown or myself, so that way we can add you to the email list as we have different free events that you might want to participate in and just gain more information. Because again, information is always the key, and it's critical in staying healthy throughout our life. So any last minute thoughts that you'd like to share on this topic or any of the other topics that we've talked about?
No, none that I can think of, but yeah, most definitely look forward to, more podcasts from us.
So again, everyone, thank you so much for being on. Definitely like and subscribe. Definitely check out our past episodes, because we've covered a lot of different topics, from diabetes to what do you take with you when you travel overseas, your healthcare kit, and a host of other topics that I can't even think of the whole list. We just keep covering more new topics every week. So again, Dr. Brown, thank you so much, and I will talk to you soon.
All right, thank you, Jacqui.